10 seconds, sorry.
Okay, good afternoon. So today I'm going to talk to you about surgical tools for invasive lumbar discectomy. So the goal of the procedure for lumbar discectomy is to remove a herniated disc material from the spinal column of a patient which is pushing on a nerve in the spinal column. So it's very painful. So the goal of the surgeon is to remove this herniated material, relieve the pain. It's a very common procedure, about 300,000 cases per year. So there's three current ways this is done. A traditional open surgery technique where you have a large incision in the back, which leads to larger chances of infection and long recovery times. Then you have MED, which is microendoscopic discectomy, which has a smaller incision, which uses a cannula system, which is physically mounted to the spinal column here. You have different tools which can be inserted into the cannula along with a fixed camera system. Then you have arthroscopic microdiscectomy, or AMD, where you have two smaller incisions on either side of the spinal column, one typically for a camera system and one for a surgical tool. Since this workspace is so small, a lot of times the surgeon doesn't have room for both the tool and the camera at the same time, so he's actually operating blind. Orthopedic surgeon who's an expert in this AMD technology contacted me about trying to design a robotic surgical tool to use for these procedures. And so the technology I'm going to present to you today kind of falls in between this MED and AMD techniques. Okay, so first we want to look at the challenges in the current techniques and use those as some of the design constraints or design objectives for our new system. So rather than having rigid probes which are not articulated, we want to have articulation and use soft materials for our instruments. We want to have an adjustable camera system. We want to be able to use legacy instruments, so incisions or ports which are 3 millimeters in size. We want to be able to use multiple ports, multiple tools at the same time for cooperative manipulation and surgery. We want them to be easily sterilizable, so they can be disposable. That would be ideal. And keep the incisions small. So the approach we came up with, you can see here, we have a surgeon who can teleoperatively control our surgical manipulators, which are mounted to a control box next to the patient. It has a cannula system, which will then have a small incision in the side of the patient, where we can have multiple tools working individually or cooperatively together. They can be repositioned to many different tool ports along with the camera. So key to this design is a disposable end effector system. So what's challenging is how you come up with it, how you manufacture a complicated mechanism into such a small workspace. So the existing designs like this are too small for our surgical site. So our solution is to use multi-material 3D printing. So here we can use print rigid and soft materials at the same time. And so we can then replace flexible links with pin joints and then drive our joints by cables affixed to these links. We've made two different 3D print end effectors so far for this application. One is a nerve retractor, which is used to move the nerve out of the way during the procedure. Another one is a grasping tool, which is used to actually graft the herniated disc material removed from the surgical site. We've tested both in benchmark tests and performance testing, and they've met or exceeded all of the target design requirements that we set forth. So if you look at a surgical system comparison between the existing techniques and our new Purdue system, we can see that the Purdue system is better in almost all cases. Key actually here, I think, is the end effector cost. With these 3D printed systems, they're very cheap, they're scalable, it can really reduce the cost, and they actually can be even 3D printed on site at the hospital. And these are some examples of our prototypes. I'd be happy to show you these next door.